In July 2025, the White House announced that President Donald Trump, then 79 years old, was diagnosed with chronic venous insufficiency (CVI), a condition affecting blood flow in the legs, following public speculation about visible swelling in his lower extremities and bruising on his hands. This disclosure marked a rare moment of transparency from an administration historically reticent about the president's health. The diagnosis, described as benign and common among older adults, has nonetheless fueled discussions about Trump's overall health, his fitness to lead, and the broader implications for presidential transparency. This response examines the medical, political, and social dimensions of Trump's health concerns, with a focus on CVI, its implications, and the public and political reactions to the news. What is chronic venous insufficiency? Definition and mechanism. Chronic venous insufficiency (CVI) is a medical condition where the veins, particularly in the legs, fail to efficiently return blood to the heart due to damaged or weakened valves. Normally, veins rely on one-way valves to prevent blood from flowing backward as it moves against gravity toward the heart. When these valves malfunction, blood pools in the lower extremities, increasing pressure in the veins and leading to symptoms such as swelling, edema, discomfort, and skin changes. According to the Cleveland Clinic, CVI affects approximately 1 in 20 adults, with prevalence increasing with age, particularly in individuals over 50. Symptoms. The primary symptoms of CVI include swelling, edema, in the legs or ankles, often worsening after prolonged standing or sitting, aching, heaviness or throbbing in the legs, varicose veins or spider veins, which are visible, twisted veins under the skin, skin changes such as darkening, dryness, or itchiness. In severe cases, venous ulcers or open sores that are slow to heal. In Trump's case, the White House reported mild swelling in his lower legs, which prompted diagnostic testing, including bilateral lower extremity intravenous Doppler ultrasounds. These tests confirmed CVI but ruled out more serious conditions like deep vein thrombosis, DVT, or arterial disease. An echocardiogram also showed normal cardiac function, indicating no underlying heart failure. Causes and risk factors. CVI can result from various factors, including age. The risk increases with age, as vein elasticity and valve function naturally decline. Trump, at 79, falls within the high-risk demographic. Prolonged standing or sitting. Extended periods of immobility can exacerbate vein dysfunction. Experts note that Trump's active lifestyle, including frequent golfing, may contribute to strain on his veins. Obesity or excess weight. Carrying extra weight increases pressure on leg veins, a factor mentioned by cardiologist Dr. Scott Cameron as relevant in some cases. Genetics. A family history of venous disorders can elevate risk. Lifestyle factors. Smoking, lack of physical activity, or prior leg injuries can also contribute. While Trump's specific risk factors beyond age have not been detailed publicly, his high-profile lifestyle, involving frequent public appearances and travel, may align with some of these contributors. Diagnosis and testing. CVI is typically diagnosed through a combination of physical examination and imaging. In Trump's case, the White House medical team conducted a comprehensive examination, including duplex ultrasound. This non-invasive test assesses blood flow and vein structure, confirming CVI in Trump's legs. Vascular studies. These ruled out DVT, a more serious condition involving blood clots, and arterial disease. Echocardiogram. This verified normal heart function, excluding heart failure as a cause of swelling. The White House emphasized that all test results were within normal limits, and Trump's physician, Dr. Sean Barbabella, described him as remaining in excellent health. Treatment and management. CVI is a chronic, progressive condition with no cure, but it is manageable through lifestyle changes and medical interventions. Common treatments include compression therapy. Medical-grade compression stockings improve blood flow by supporting veins and reducing swelling. Experts like Dr. Christopher emphasize this as a first-line treatment. Lifestyle modifications. Exercise. Regular walking strengthens calf muscles, aiding venous return. Leg elevation. Raising legs above heart level reduces pooling. Weight management. Maintaining a healthy weight alleviates vein pressure. Medications. Venoactive agents may reduce symptoms, though aspirin, which Trump takes for cardiovascular prevention, is not a primary CVI treatment. minimally invasive procedures. For severe cases, treatments like endovenous laser ablation, radiofrequency ablation, or sclerotherapy can close damaged veins. The White House has not specified Trump's treatment plan, but Press Secretary Caroline Leavitt stated he was experiencing no discomfort, suggesting mild symptoms manageable with conservative measures. Complications if untreated. While CVI is generally benign, untreated cases can lead to complications. Venous ulcers. Persistent blood pooling can cause open sores that are difficult to heal. Skin changes. Thickening, discoloration, or inflammation may occur. Increased risk of DVT. Though Trump's test showed no DVT, untreated CVI can elevate this risk. Dr. Aaron Aday noted that minor injuries, like an ankle sprain, could become severe in unmanaged CVI, leading to chronic wounds. Public observations and speculation. The announcement of Trump's CVI diagnosis followed public scrutiny of visible physical signs, including swollen ankles, noticed during appearances, such as at the FIFA Club World Cup, prompting online speculation about his health. Bruising on hands. Photos showed bruises, some covered with makeup, attributed by the White House to minor soft tissue irritation from frequent handshaking and aspirin use. These observations sparked widespread discussion on platforms like X, with some users speculating about more serious conditions, including unsubstantiated claims of cognitive impairment due to reduced blood flow. Such claims lack medical evidence, as CVI primarily affects peripheral veins and is not directly linked to brain function. However, they reflect public sensitivity to Trump's health, given his age and high-profile role. Historical context. Trump's health transparency. Trump's administration has historically been guarded about his health, making the CVI disclosure notable. Past examples include 2015 medical letter. Trump's then physician, Dr. Harold Bornstein, claimed he would be the healthiest president in history, a letter later revealed to be dictated by Trump himself. COVID-19 in 2020. Trump's severe illness was downplayed, with details emerging only later through external reports. His low oxygen levels and need for experimental treatment were not initially disclosed. Annual physicals. Reports like the April 2025 physical often describe Trump as fully fit, without detailed data, raising questions about completeness. The CVI announcement, prompted by visible symptoms, was described by experts like Dr. Jeffrey Coleman as a breath of fresh air for its relative transparency, though skepticism persists about whether full details are shared. Presidential historian Barbara Perry noted the tension between public interest and a president's privacy, with no legal requirement for full disclosure. Political and social implications. Trump's health has been a political flashpoint, particularly given his age and comparisons to President Joe Biden, who faced scrutiny over cognitive health before exiting the 2024 race. Trump's campaign often contrasted his vigor with Biden's perceived frailty, making his own health disclosure sensitive. The CVI diagnosis has fueled political narratives. Trump supporters praise the disclosure as evidence of transparency, while critics argue it's selective, driven by unavoidable public scrutiny. Sparked comparisons. Trump's accusations of a Biden health cover-up contrast with his own history of limited transparency, creating a debate over presidential fitness standards. Raised governance questions. At 79, Trump is the oldest elected president, and he will be 82 by the end of his term, surpassing Biden's record. Public interest in his health reflects concerns about leadership capacity. On X, posts range from concern about Trump's health to skepticism about its severity, with some alleging cognitive decline without evidence. These claims are inconclusive and often politically motivated, but they underscore the polarized lens through which Trump's health is viewed. Medical and public health context. CVI's prevalence, affecting 10 to 35% of U.S. adults, normalizes Trump's diagnosis, but its public discussion highlights broader issues. Underdiagnosis. Dr. Scott Cameron noted CVI is often underdiagnosed, leading to significant healthcare costs from complications. Aging population. As the U.S. population ages, conditions like CVI are increasingly relevant, emphasizing the need for early detection and management. Presidential health standards. The lack of mandatory health disclosures for presidents raises questions about balancing privacy with public accountability, especially for older leaders. Conclusion: President Trump's diagnosis of chronic venous insufficiency, announced in July 2025, is a common, manageable condition that has nonetheless reignited debates about his health, transparency, and fitness to lead. While the condition is benign, its visibility, coupled with past opacity about Trump's health, has amplified public and political scrutiny. Medical experts emphasize that CVI, with proper management, does not significantly impact life expectancy or leadership capacity. However, the broader context of Trump's age, historical secrecy, and the polarized political climate ensures that his health will remain a focal point. For further details, reputable sources like PBS News, Cleveland Clinic, or the White House press briefings provide reliable information.